If you're suffering with numbness and tingling in one or both hands, you're probably wondering where it's coming from, how it started in the first place, and what it is you can do about it. We have had many patients coming in recently. They started to have numbness and tingling in their hands. Some of them, it's carpal tunnel syndrome. Some of them, it's not consistent with carpal tunnel syndrome. And they're wondering what caused this problem in the first place. So today we're going to talk about the most common cause of hand numbness and tingling, especially if you have it in both hands at the same time. And we're also going to discuss what steps you need to take to eliminate your hand numbness and tingling. Now, first thing I want to start off with is a word of caution. If you're struggling with hand numbness and tingling, especially if there's nothing that you can do to relieve your symptoms, I want you to reach out to a specialist immediately, because numbness and tingling indicates that there's a nerve problem. If you have a nerve problem, you need to get that looked at immediately. Nerves are very sensitive, and we now know that they can heal, but we need to figure out why they have the pressure in the first place, because that's what causes the numbness and tingling, and we need to relieve that as quickly as possible. If the numbness and tingling starts to turn into like a weakness that is pervasive, so maybe you have difficulty picking up your coffee cup every morning or picking up a glass of water or something like that, you definitely want to seek help, because we don't want to have any long-term damage from any numbness and tingling. And those nerves are sensitive. They can heal, but we need to get on it as soon as possible. Whereas when you're just having pain problems, usually that's more of a ligament, joint, something like that. There's a little bit more leeway in how long it is till you can get help. So if you're suffering with numbness and tingling, I highly encourage you to watch the rest of this video, try some of the ideas that we have to relieve that. But if that doesn't work, I want you to reach out to a specialist so you can figure out exactly what is causing your numbness and tingling and get the help that your body needs. Now, is the numbness and tingling that's in your hand actually coming from your neck? Many people who come into the clinic are very surprised to hear me say, well, we're going to check out your neck when we do the evaluation, because they don't understand how it's all connected. So let's talk about that first. In your neck, you have 8 cervical nerve roots that come out. And as they come out, they kind of interplay with each other. And then they go through your shoulder and they interplay even more, and then some of them come together and go into your hand. Specifically the median nerve, that's the one that causes the carpal tunnel type syndrome. So if you feel like you have carpal tunnel syndrome, it's probably a median nerve problem. But you also have the ulnar nerve and the radial nerve. So some people come in and they have numbness and tingling in their hand and they think it's carpal tunnel syndrome, but their symptoms are not actually in that median nerve pattern. You see, each nerve has its own pattern. So we can tell which nerve is actually getting irritated. Now, the important thing to do during the evaluation is to figure out where that nerve is getting pinched. So it travels a long distance, right? It could be getting pinched up in the neck. That's often very commonly where it starts. It could be getting pinched as it goes through the front of the shoulder. That's kind of the second most common spot. But it can actually be getting pinched in the arm or in the forearm. And so it's important to have a complete evaluation so you understand where your symptoms are coming from. Because if you follow these tips that I'm presenting today, it may not help you at all, because that may not be where your pinch is occurring. And we'll talk about this more as we go along today. But I wanted to just reassure you that if you feel like this video did not help me at all, it's probably because your pinch is actually coming from somewhere else. So what we're going to talk about today is pinching that's occurring in the neck, because this is the most common one that I see in the clinic. Now, I will say sometimes you can get a pinch in your neck and then it puts some pressure on the nerve, but it doesn't reach threshold. So the nerve doesn't actually start talking just because of the pinch in the neck. Sometimes what happens is what we used to call a double crush syndrome. So basically the nerve was getting pinched in the neck and then also getting pinched somewhere else along the pathway. And this is commonly what I see in the clinic today, is that most people have had this long-term neck issue, but it didn't cause problems in their hand until it got down into their shoulder, their arm, or their forearm. So the double crush terminology is not very popular anymore. They don't really like that word. So it's kind of out of vogue in the medical community. But I do feel like it's really helpful to actually understand what's happening in that area. It really explains it very well. Now, don't be concerned if you're like, oh my gosh, I have a double crush. The reason why the vernacular has gone away is because it sounds really bad. If it sounds like, oh, it's a double crush, my nerves crushed in two places. And that's why it's kind of gone out of vogue, because it's not actually crushed. There's pressure on it, or there's inflammation around it. It's not like your nerve is getting crushed and it's going to die all of a sudden. But it is an indication that there's something going on, maybe at more than one spot, which is why it's important to work with a specialist to figure out exactly what's going on with your body. Now, some people had their symptoms start as like a neck pain or maybe a neck tension that they noticed. And then after a while, because they didn't address that, they started to have some hand numbness and tingling. So that's what we're going to be talking about today. We're going to be talking about the nerve roots in the neck getting irritated either by the disc, which they come out right next to it, or by the facet joint, which is where the vertebrae talk to each other. And that can get inflamed, which can cause an inflammatory soup around the nerve root, which can send symptoms down into the hand. Yours may not have started out as a neck pain, but you may have been suffering with neck stiffness or something like that for a long period of time. And after a month or maybe even more, you started to notice some hand numbness and tingling. The usual suspects that I see when I hear about hand numbness and tingling are, one, people who sit at a desk for a long period of time. It is difficult to maintain proper posture, even if you have a good ergonomic setup, and people struggle to maintain their head on top of their shoulders and their shoulders on top of their hips when they're sitting for long periods of time. The second most usual suspect is people who perform repetitive tasks. So if you're doing the same task over and over and over again, or if you have to maintain a position for a long period of time, especially if you're holding something heavy, that can cause the muscles in the neck to become tight and can also lead to hand numbness and tingling. And the third usual suspect is people who carry stress in their neck and shoulders. And honestly, friends, in today's day and world, I don't know anybody who doesn't carry stress in their neck and shoulders. And so it can be very difficult to maintain that proper alignment and keep those shoulders away from those ears. Now, I live in the Pacific Northwest, pretty close to Seattle, and a lot of people who live out here drive a long way for work. Well, maybe not necessarily a long distance, but it takes them a long time because of traffic. So if you're sitting in the car for more than a half hour, but definitely more than an hour every morning and every night, especially if you're stuck in traffic, which can cause stress, chances are good that your posture starts to decline over time, and car seats are not known for having the best support and keeping you in the best position. I know in my car, when I'm in there for a long period of time, it's difficult to maintain that good posture. So if you drive for a long period of time, especially if you commute more than a half hour, but definitely more than an hour, this may be the cause of your hand numbness and tingling. All right, now you may be saying, but Dr. Amy, how do I know if it's actually my neck that's causing my problem? So there is a really simple test that you can do to see, and what we're looking for with this test is not so much pain. We're looking for reproduction of your symptoms. So you're going to do this cautiously, because if you start to have symptom reproduction, then I want you to stop. This is not do this until your hand like falls asleep or something. Don't do that. But if you start to have symptoms, you're going to stop immediately. Now, again, you're not looking for pain. This is a sometimes provoking position, often I would say provoking position for most people in today's culture. So the goal of the test is not to reproduce pain, although you might. The goal is really to see if it reproduces your numbness and tingling. So what you're going to do is you're going to turn your head to the side that you have pain. So let's say for right now, it's my right hand that has numbness and tingling. I'm going to turn all the way to my right side, and then I'm going to tip my head back as far as possible and try to look up towards the ceiling. So what that's going to look like, again, this is my right hand and I'm looking for symptoms in, is I'm going to turn, I'm going to tip, and then I'm going to look up towards the ceiling. What that does is it shuts down that facet joint. So that causes compression of the facet joint, which is why it can be painful, because if you have any facet joint issues, it's painful. It can also pinch a disc. If there's a disc that's a little bit herniated and sticking out there, that can also be painful. But what it does is puts a ton of pressure on that nerve root. And what you're going to do is hang out there for about 20 seconds and see if it reproduces numbness and tingling in your hand. Now, as I said earlier, the word of caution is as soon as it does come out of that position, if it starts reproducing your symptoms as soon as you get in it, don't stay there for 20 seconds, friends. We're not trying to see how much pain we can cause you. That would be ridiculous. But if that accurately reproduces your symptoms or even lightly reproduces your symptoms, then chances are good that part of what you're suffering from at least is coming from your neck. All right. So if that test was positive, what can you do about it? The first thing I want you to do is modify your posture. We want to make sure that your head is on top of your shoulders and your shoulders are on top of your hips when you're sitting or standing. You want to make sure that you're not in a forward head posture. You want to make sure that you're in a good posture when you're driving or when you're on the computer. And friends, we want to avoid that text neck. So if you spend a lot of time looking down at your phone for prolonged periods of time, that causes increased stress to your neck and shoulders and can be putting pressure on the discs and joints, which can be causing hand numbness and tingling. So I need you to get those phones up where you can see them up here. You can prop your elbows to make sure that you have good support so you're not causing tension in those muscles, but you need to make sure that it's up far enough that you're not having to look down for prolonged periods of time. Now, you also want to figure out what position is actually causing this issue. So for some people, it is that forward bent for a long period of time. Again, if you do repetitive tasks, it could be because of the position you're in doing repetitive tasks. And it most commonly is if you're at the computer for long periods of time, because that head tends to come forward, especially if you don't have a good ergonomic setup. So make sure that you have a good ergonomic setup. Make sure that you're getting up regularly from your desk to go ahead and move around and readjust your posture. Now that you know what position is causing your symptoms, you can actually stretch and do some exercises in the other positions. So initially, we want to avoid the provoking position, and we want to do some stretches and exercises that will help in other positions. So I'm going to link a video here and at the end of this video that give you some stretches that you can do that will probably be helpful for you. And of course, with the caveat of if this is the position that causes your symptoms, then don't do these exercises. And the most important thing that you can do is to seek help from a specialist. It is critically important, especially if you have numbness and tingling anywhere in your body, but especially in your hands, that you get help as quickly as possible, because we want to take pressure off that nerve, relieve those symptoms, decrease your pain, and make sure that that nerve has the ability to fully heal. We don't want to get to a point where you have weakness in your hand, or even let it get to a point where it's bothering you 24/7. A lot of patients that I see don't come in and seek help until they can't get rid of the symptoms at all on their own. What that tells me about the state of the nerve is that it is really inflamed and really irritated. It makes it more difficult to treat if you wait longer to get help. Now, you may be saying, well, I did that test, Dr. Amy, and it was negative. It did not reproduce my hand numbness and tingling. Well, then chances are for you that you are actually not having a neck issue, which means probably those tips are not going to be super helpful for you particularly, but you have an entrapment issue further down, either in the shoulder, in the arm, or in the forearm. So for you, it's important to figure out where that nerve is getting stuck or hung up, and to find ways to relieve that nerve tension. That may be doing some sliding, some gliding. You may need some soft tissue mobilization to get the muscles moving better. But if it's not coming from your neck, that's great news, but you do still want to figure out where it's coming from. Because if you're having numbness and tingling, it can still become a bigger problem over time if you don't address the root cause. All right, I'm going to link that video here to give you some ideas of some stretches that you could do that will be helpful for you. Again, with the caveat that if these are the stretches that are putting you in your provoking position, then please do not do them. All of these exercises and stretches that we have on this YouTube channel are meant to decrease your pain or decrease your symptoms. And we say this regularly during the videos, but we really can't say it too much, that if you are struggling with pain, numbness, or tingling, if anything we recommend increases your symptoms, then please stop doing it. The goal is not to increase your symptoms. Pain is a signal that your body is telling you that something is wrong and I need help, which means nothing you do to relieve your pain should increase your symptoms. So make sure that everything you're doing is actually helping things get better as opposed to making things worse.